As a next-generation accountable care organization, Bellin Health Partners was recently named top in the nation in reducing the cost of healthcare while raising the bar on quality. Our team-based care approach helped us get there, and it's making a difference in the lives of patients like Rodney. This is his story.
We've had our eye on taking care of patients in a non-fee-for-service world for almost a decade now. So we started thinking, it fits our mission, it fits our vision that our patients are going to be the healthiest that they can be and at low cost. So Rodney's pretty typical for most of our type 2 diabetics. Usually when we first diagnose them, they can have variable control with how well their blood sugars are. And over the years, like most people, it got worse and worse. And Rodney had ups and downs. Probably the biggest breakthrough that happened is when I had to meet Katie Dallabrew, our pharmacist. Katie had one visit with him and discovered something that I wasn't aware of, and that was the depression that he was suffering from.
When you have that appointment with the pharmacist, it's one-on-one with the pharmacist. We're specifically looking at medications. So I had that entire appointment to really focus on the medications and his concerns with those medications. So I was really able to identify what his concerns were and what the barriers potentially were, and then address those. Also, just knowing that I would be following up with him, and that if there were any potential side effects that he did start to have, that we would walk through those and make any adjustments if needed.
What we noticed after Rodney had agreed to medical management of his depression, he was much more determined and willing to put in the effort to work out. He's bought exercise machines since then. He will call and say, well, this is what I want to do for exercise. What do you think of that? He's increased the amount of time that he's exercising. He's been much more cognitive of what he's eating. He's way more willing to learn about what do I need to be doing, how can I be better.
People at the Denmark Clinic are helpful, friendly, and if you need more help, they'll try and more than likely get it for you. It helps you get better if you know that the person who's trying to make you better is on your side.
We'll put together a plan in place with set follow-ups. It says we're going to call you in a week or two and see how you're doing. And really what it does is it reinforces our plan of care for them.
If we're just saying, this is what we think you should do, I find a lot of times they may follow it, but as soon as they maybe get a side effect, or the medication cost is too high, or it just gets too overwhelming, they'll stop. And if they know why they shouldn't stop, or why we're asking them to test their blood sugars, why are we asking them to take their medication in the morning versus at night, the adherence to that plan goes up greatly.
You're showing these people that you're here for them, and they're trusting you, believing you, and having faith in you to take care of them.